Hi, I'm Dr. Charles Cobbs. Welcome back to BrainCancer.org series of lectures on Brain Tumors 101. I'd like to talk today about what you do if you're diagnosed with a brain tumor and how you negotiate the early steps of that diagnosis. Getting a diagnosis of a brain tumor is extremely frightening for most patients and family members, and often patients will have a seizure or some type of neurological deficit that will cause them to go to the emergency room, and there a CAT scan of the brain or an MRI scan will be performed. When patients are told that there's a mass in their brain and that it may be a brain tumor, of course they have huge amounts of fear, and often it's difficult for them to make rational decisions in that setting. What's important to know, however, is that it's important to make sure that wherever you are, that you have access to not only physicians who have expertise in brain tumor treatment, but also, even more importantly, possibly being affiliated with a center that allows patients to come and become enrolled in clinical trials. For instance, many small community hospitals have neurosurgeons who will be the first provider you will interact with. And sometimes these neurosurgeons will have expertise in spinal surgery and not a huge amount of expertise in brain tumors. And patients who get treated at these community hospitals may not have access to clinical trials which require having their tumor operated on at a center where the tissues can be preserved in order to allow them to be candidates for trials that involve, for instance, vaccine treatments to their tumor. Most of the time when someone is diagnosed with a brain tumor, even though it's very frightening for the patient and the family members, it may not actually be an emergency in which they need surgery. I would caution, however, there are cases where there are emergencies and there's huge amount of swelling, for instance, and the patient may need surgery within a few days. More frequently, however, patients don't have an emergency, and because of that fact, they should be open to the possibility of conferring with one or two or more providers at different facilities to see what options are open. Sometimes patients will find that different physicians offer different opinions as to how the treatment should go, ranging from a biopsy to a complete resection to a resection and enrolling in clinical trials. Therefore, my recommendation for patients who have a diagnosis of brain tumor is to call around, find centers of excellence in your region, go talk to the providers who treat brain tumors frequently, and find out which clinical trials are available and what options are open to the patient. Thank you.